Well, let me say a couple things. First of all, I fundamentally believe as a Christian that we should do whatever we can to take care of the less fortunate. I believe in a safety net.
Mm-hmm.
I believe, particularly as someone who's been on the Ways and Means Committee who has studied our entitlements, what are called entitlements. Some people don't like that term, but that's what they're called, because if you legally qualify, you are entitled to receive them. And so I believe in the safety net. The safety net has a lot of problems. And Medicaid and Medicare are both heading to bankruptcy more quickly than Social Security. Some of that's demographics. So I start with the premise that we need to fix, and I have advocated and voted for reform to fit what I believe would start to fix some of the problems with Medicare in particular. So that's number one. I believe in a safety net. Number two, the fact that some people have been helped through the Affordable Care Act does not mean that that was the only way to help those people. We should help as many as we can. One way to do that, one way to make healthcare more affordable, is to lower the cost so that more people can afford it. That's one thing to do. Most experts will tell you the Affordable Care Act, did not make things more affordable. Now, for some people who are getting it on the government dime completely, obviously that's more affordable. But for a lot of other people, it's not more affordable. In fact, I would say that what the goal with helping those who need access to health care is to help get them health care without messing it up for everybody who already liked what they had. That should be the goal. Here's why Obamacare, or the Affordable Care Act, the president now calls it Obamacare, so I'm going to call it Obamacare. Okay. Obamacare, the problem is, yes, there are some people who gain from it, but you messed it up for a bunch of other people in the process. If I believe that was the only way to do it, that'd be a different conversation. But I don't believe it's the only way to do it. And let me say something. I'm glad you asked it. I can sit here for an hour, which I can't do. We've got to be at the Arsenal at 3:30. But so I believe it is a false choice to say it's Obamacare, where few people, some people are helped, and a lot of people are. Their whole apple cart's upset because their old insurance is doubled or whatever. It's either that or nothing. That is a false choice. That is fundamentally a false choice. And I say to people, the percentage of people, whatever they are, who have benefited from this, do not buy the line that if we don't do it this way, then there's no way. I completely reject that. And in fact, here from a 30,000 feet level, the problem with Obamacare is that is a one-size-fits-all, top-down, Washington knows best approach, central control approach that says this is what the country has to do. And the president, in effect, says, I know what insurance you need and what insurance you don't need, and I'm going to determine that. Okay. That's what's wrong with it. Now, the president has said repeatedly, that's a general view of what's wrong with it. I can give you specifics. For example, we had a hearing in the Ways and Means Committee on this issue. The Obamacare says that if you work 30 hours or more, you are full-time. How many people do you know that believe 30 hours is a full-time job? I don't know any. In France, the law is 35 hours or more, and they're moving it to 40. I don't know anywhere where 30 hours is full time. So I asked a Stanford economist in my hearing, who came up with that? And he goes, I think they pulled it out of the air. Why is that important? Because what has happened, because of the burden of Obamacare, what has happened is you have a situation where companies have said this is not affordable, this is unaffordable. So community colleges have done this in Little Rock, companies I'm sure in Pine Bluff, county governments, they've said, we're going to cut our workers' hours to 29 hours or 28 or whatever, so we don't have to provide them that insurance.
Is that the fault of the law, though, or is that the decision that those particular entities have made?
Well, it's a problem with the law because the law is written in such a way where the companies that were already affording health care for their employees now can't. We had some people testify in front of our committee who basically said, look, we have always worked to provide health care for our employees. Mm-hmm. But now that the premiums have doubled or whatever, we've had to look for places to cut back. So here's what happened. So you've got a pool of people who by all accounts are the most vulnerable, the people working hourly, the people working less than full time. And I've got some studies that show they're the vulnerable. They're the more elderly. They're the single moms, et cetera, et cetera. You've got these people who may have had insurance, maybe not, but a lot of them may have had some kind of insurance. Didn't meet the standard of this, but they had something. And then the Affordable Care Act says, we're going to make sure you have really good insurance. They end up with less income and no insurance. And that's not one anecdote of some story that happened. That has happened all over the country. My point is there are ways to do a lot of this stuff without doing top-down, giving states who have different demographics flexibility. And let me mention a letter. I don't know if you've been getting you probably have my press releases because you're not in my district.
Right.
On the congressional level, and but in December, the president gave a speech, and he said, "If you've got ideas on healthcare that you think make healthcare better," mm-hmm. sort of knowing he's not going to sign a repeal of Obamacare. As long as there's someone named Obama in the White House, he's not going to sign a repeal of Obamacare. We've tried, and I'm on record on that numerous times. But so he basically said, if you've got some ideas, let me know. I'll be glad to discuss it with you. And it sounded to me like he was directing that to Congress. So I wrote a letter with 34 other members of Congress in December before the holidays. And I said, Mr. President, heard what you said. I believe we've got some ideas that, for the most part, are independent of the Obamacare exchanges. We'd like to talk about them. And let me give you some examples. Expand the role of health savings accounts. Give people more choice over their health care decisions and use health savings accounts to do that. I believe that we have health savings accounts now, but there's so many restrictions, they become harder and harder to use, and fewer people want to use them. So that's number one. Number two, how about competition across state lines for insurance companies? For example, instead of having 2, 3, 4 companies to choose from, one company dominating 70-80% of the market in some states, even more. When you look for an insurance plan, maybe you say, I like the plan in Oregon because it suits what the health condition I've got. Or I like, open up the choice so that it's not limited to a state. There's a bill that does that. We've got over 200 health care bills that House Republicans have introduced. Many of them are just reform incremental, piecemeal. but some of them are relatively comprehensive. Dr. Price of Georgia, I'm sure you've heard of Tom Price of Georgia, he's got a bill. Steve Scalise of Louisiana has a bill. There's a new bill in the Senate that you've probably heard of. Senator, I think Senator Burr and some others put a comprehensive reform together. So the bottom line is there are a lot of ideas that we can discuss, and I want to discuss them. Well, it's now been about 60 days or so, maybe a little more, and we've heard nothing. Not one peep from the White House, no letter, nothing. Now, if you go back and look at the State of the Union, the President reiterated that. He said, if you've got some ideas, I want to hear about them. I want to have that discussion. So after he said that, we reiterated, we're ready. So we're waiting, but the point of this is not just the fact that there's been 60 days without a response or whatever that exact number is. The point is there are a number of ways to reform the healthcare system that do not involve what is tantamount to the regulation of some say 1/6 of the U.S. economy. The federal government does not have a good track record managing massive programs. Medicare, like this, Medicare is going bankrupt. That's a fact. Medicaid is going bankrupt. That's a fact. And you know what? There are a lot of seniors that contact my office. You know what they tell me? I am eligible for Medicare, but I cannot find a doctor who will see me. Do you know why? Because more and more doctors are fed up with the bureaucracy and all the stuff they have to deal with. That's one reason we're trying to patch what I'm sure you know is the SGR, Sustainable Growth Rate. Right. We are working on a bipartisan solution to that now, Energy and Commerce and the Ways and Means Committee. So the bottom line, there are other ways to get to the goal, which is a shared goal. Just because you have a good goal does not mean that the path you take to that goal is the correct one. And I think that's where we differ.